In a Car with IPR is a new series by the Institute for Public Relations where we talk to industry leaders to find out what makes them tick, discuss research, and ask them to look into their crystal ball to see what's in store for us. All right, so thanks for joining us for our next episode of In a Car with IPR. We're here with the Chief Communications Officer of Medtronic, Rob Clark, in a great city of Minneapolis.
The great city of Minneapolis. Yes.
City of Minneapolis.
Yes.
Thanks for being here.
Welcome.
This is great. So we're standing here. So tell us where we are in the city.
Sure. Well, we are standing on Medtronic Plaza, and the plaza is the front end to US Bank Stadium, which is Minneapolis's and really Minnesota's brand new stadium that we built for the Minnesota Vikings. Opened in 2016. And Medtronic's just been really pleased to be a partner with the Vikings and US Bank Stadium. And so we're here on Medtronic Plaza, and we're also in front of the horn, which is really a piece of art which really signifies some key aspects of the Twin Cities community. One is around progress, the other is around partnership. And as we partnered with the Vikings and we partnered with the stadium, really wanted to set a kind of a visible example of that aspect of the community.
So for people who may not be as familiar with Medtronic and what you do, if they're not in healthcare or a patient, why don't you give us a
Sure. So Medtronic, from a size perspective, we're about 90,000 employees. We're in 160 countries around the world. And we were based and founded here in the Twin Cities, just north of here, by an engineer and his brother-in-law in a garage. We're, like a lot of technology companies, founded in a garage. And really what the company was founded on was the notion of taking technology and applying that to alleviate pain, restore health, and extend life. And that's really been the mission of the company since its founding. And that's what we do. And we do that across a range of technologies and devices for cardiac issues, diabetes. We do work on the spine. So really anywhere in the body where there's a chronic disease or an affliction, we have some sort of technology or instrumentation that can help address that situation for the patient.
So you brought some show and tell
Sure.
to sort of illustrate
what
you do.
You know, it's indicative of the innovation that goes on at our company. Again, our founding was sort of a simple founding where our founder was an electrical repairman. And what he did is he was repairing electrical equipment within the hospital. And what often happens at that time, this is back in the late 1940s, there were pacemakers at the time that were the size of a cabinet, and the patient literally pushed them around.
Wow.
They had to be plugged in. They were not battery operated. And the story was that there was a young patient, a young child at the University of Minnesota, and there was a storm that came through. They lost electrical power to the building, and as a result, this individual died because their pacemaker was not charged. And so the physician at the time, who's one of the pioneers actually in cardiac surgery, contacted Earl Bakken, our founder, and said, is there some way we can create a battery-powered version of this pacemaker? Within a week, Earl had created what essentially became the first battery-powered pacemaker.
Oh, wow.
It's a device about this big. It hung around the neck. It was implanted. It started to be used with children literally the next week. And really, pacing and electrical stimulation of the heart is the founding of the company. And from that, you get to a point where in the last decade or so, this is kind of a modern pacemaker implanted in the chest, leads are then strung into the heart, and it regulates the beating of the heart. Today, that same device is now this size. This is kind of a modern pacemaker. Again, the size of a small thumbtack, really. It's implanted through a catheter that goes in through the arteries and up into the chest. And this device itself would last over 10 years. The battery inside will last over 10 years. We manufacture and produce all the batteries as well. But what this shows is that just the continual innovation that's happening in medical technology, again, to treat diabetes, cardiac disease, spine and chronic pain, movement disorders associated with Parkinson's and Tourette's and things like that. And so it's really a fascinating company, but it's based upon this kind of innovation.
So today we're going to walk around the stadium, do all sorts of fun things.
Right.
And then we'll
not
talk
in a car.
about research.
We won't be in a car.
No, but we can, I'm sure we can
But it's
steal
kind
it.
of like we're in a car.
We were in a car earlier.
We were in a
just
car.
not
We took a
recording
car
it.
to get here.
Yes. Okay, Rob, we're here inside the stadium.
Yep.
Sitting next to 4 distinguished men.
Yes, this is a replica of what was called the Purple People Eaters. This was the defensive line of the Vikings in the 70s. They were kind of world famous. I think most of them are in the Hall of Fame in some way. But so Jim Marshall, Alan Page, Carl Eller, and Gary Larson. That's the 4 Purple People Eaters and Vikings legends.
So you've been at Medtronic for 16 years, and you were a boomerang because you left,
Yeah.
and then you came back.
I did.
Right. So what under your as CCO, what sort of responsibilities fall under you?
So I have, I have what we, sort of the traditional corporate communications remit in terms of, public and media relations, employee communications. We do a lot of executive communication support for our executives around the world. So that sort of typical or traditional communications. We also have a pretty substantial, we call marketing communications group that really is the group that partners with our marketing colleagues around the world to design marketing programs and all the supporting collateral materials and communications, social media, the things that go into those campaigns. And then I have a digital team as well. So our digital team does both infrastructure all the way up to content and distribution as well. So great team. The Medtronic global communications team is about 400 folks around the world. And it's been a great team to work with and really proud of the work they've done.
Yeah, so for IPR, we're going to do a study in the spring looking at the progress of digital. And because you did mention you have like digital that falls there as well, the digital
absolutely.
team. And sort of what is the trajectory of people in that role? Like how, what is the leadership path, which I think there hasn't been much research on, so we'll see how that is. So Medtronic a couple years ago, you did a campaign, because before you were very product focused, technical driven, then you changed to very like purpose driven, based on data, very data-driven campaign to be more patient-centric. Do you want to talk about the comms role in that campaign?
We're historically a B2B company, and so our products will end up in a patient, but they're historically have been selected and implanted by the physicians, and that's still true today. And yet, the way healthcare is changing, transparency of information, the internet, things like that, many more people are now involved in the process. So just like you or I would do if you're told you have a chronic disease or some sort of issue, you're going to go research it. You're going to look online. You're going to see what does the clinical data say? What are other patients saying about their experience with a technology? So we have seen where the patient, where other people within the hospital are now part of the buying process all the way up into the C-suite. And so we felt like we needed to make sure that we had a communications approach and a marketing approach that was geared to all the constituencies that were a part of it versus only the physician. So we still focus on the technical sell of our products and what they do in terms of what the physician cares about, but we've broadened our trajectory of communications to speak to those other audiences as well.
And what is sort of the tagline for the
so we came up ultimately with this notion of further together. And further for us means we're an innovation technology company, continuing to push ourselves. We have to innovate in new ways. We do have a perspective that we need to innovate not just to innovate, but that we're doing innovation and creating products that contribute to both the clinical value of the equation, but also the economics. Healthcare is under a lot of pressure. Affordability of healthcare is an issue. We need to contribute to that with our technologies and services by helping bring the cost of healthcare down for people.
As you know, like IPR just released that disinformation study, and one of the ways that we set it up, we said we gave them a whole list of problems, and we asked people to rate what they deemed like a major problem, minor problem, and healthcare cost was at the top. It was like 78% of respondents said healthcare cost was the number one problem that we face, like higher than terrorism, economy, crime, education. Disinformation was 63% again.
It's not surprising. I mean, I think we all see it just even in our own personal lives, either through our loved ones or others. the cost of healthcare continues to rise. It's less and less affordable. We believe we have to contribute to bringing those costs down. So are there technologies or services or software or things that we can bring to the market to help bring the total cost down?
All right, we're gonna ready to walk around, like blow a horn or something.
We're gonna go to the real Gallahorn.
To the real Gallahorn.
To the real Gallahorn. I want to thank these guys for
I keep
being here.
leaning
Thanks
on
for being here. Yeah.
All right.
Okay.
You ready to talk about research?
Let's talk about some research.
All right. It's my favorite topic. Sometimes. All right. So IPR, of course, we're a research arm, and we just do a bunch of research. So I'm not going to quiz you on the findings.
Thank you.
I'll just ask about the impact on what you do based on our amazing findings.
Yes.
So the first study, and this is our most recent study, we talked about it briefly earlier about disinformation, which is deliberately misleading information.
Yeah.
And we use that specific term and not fake news, because fake news, what people perceive, is just news they don't agree with.
Yep.
Yes. So in that study, we talked about the healthcare costs, but one of the, it was sort of outside industry, but also we had a lot of questions about the industry. Some of the questions we asked were, how much do people trust in certain sources?
Yeah.
How much they think certain sources are responsible for the spread of disinformation, how much should they be for fixing it, and how well people are doing.
Yeah.
And what we found is that there's a huge difference between how well people are doing and what people think we should be doing. And there's a gap, right? More people think that this group should be like PR professionals, and we're not doing a great job of it.
Yeah.
But we also asked like trust in sources, and what we found is that trust isn't going so hot for these groups. So like CEOs,
institutions in general,
like companies, CEOs, marketers, PR professionals, about, I would say, anywhere from 23% to 27% said they had some trust in these groups. So fairly low. So what do you think we need to think about with that as an industry, and how do you deal with that from like an organization perspective?
It's tough. I mean, this is, I think, the challenge of our kind of professional time, right, in our careers, is making sure that we can cut through the clutter with credibility. It's particularly important in healthcare. We're making technologies and we're delivering therapies that people ultimately have to believe in and trust the data around them and their impact. And these are complex things. And I think we see this in our day-to-day work of the complexity of what we do. How do we make that simple for people to understand? But also, how do we make it simple enough and credible that they believe in what we're saying?
So we are in the second phase of a study. We actually have right now 700 respondents.
Yeah, great.
Which is great for a survey that we're doing, looking at women in leadership in the industry. We're partnering on that with KPMG. And as an industry, I know we're sort of behind on the whole D&I thing, and I know that's something that's important at Medtronic as well. So what are your thoughts about that, and what we need to do as an industry to improve what we're doing?
Yeah, it's interesting from a gender perspective. We feel like this is like a lot of companies, this is a big focus for Medtronic. We have a stated aspiration as a company that we want to have 50% of our leaders to be female. We're over 40. We just went over right around 40%. So we have more to do. In the communications field, it's interesting. My team, my management team, down to what we consider to be the senior manager level, is 75% women. My direct leadership team is 83% women. So but we are an anomaly within Medtronic, and I think we're an anomaly in the industry. I've been very fortunate in my career, even back to the Air Force, where I've always been around really, really impressive women leaders. And we've just been able to, I think, some of it is luck, some of it is intent, but we do have a great team of women leaders in the function in Medtronic. I know that that's an anomaly, that's not what's going on, but we have to focus on the things you're talking about to preserve that. Mentorship, sponsorship, development, clear pathways, And but I'm proud of where we're at. I actually think the gender thing is a problem. I also have a passion and belief around the diversity of our workforce in terms of African Americans, Latino, people from those descents. I think we also have a lot to do there, and we're not where we want to be at Medtronic, both in our function across the company. And so we're focused on both, but that has my attention as well.
Yeah, we're doing a separate initiative with some of the other organizations.
Yes.
And,
I know about that work, and I'm really looking forward to that.
It's going to be good.
Because I think, well, both studies I'm really looking forward to, but I'm looking forward to see what we can learn at Medtronic from those studies and how we can improve what we're doing.
Yeah, because it's time. It's past time. So,
it's past time.
Okay, so I'm going to ask some Rob Clark questions.
Okay.
You ready?
All right.
Okay, so what is your career highlight besides this today?
Yeah, I mean, a lot. I've got many great times, right, at Medtronic, really. It's been fortunate, as we said earlier, I've been fortunate to be here 16 years. Done a lot of interesting things over that time. Really proud of the work that our team did with the Covidien acquisition. This was a company we purchased back in 2014-15. It was the largest and is the largest acquisition in the medical device space. It was a $50 billion acquisition. And to go through both the acquisition phase as well as the integration phase of bringing those employees into Medtronic over the last 5 years, it just really was a highlight of my career and our team's work.
So what is the best advice you've ever been given, or just advice you always live by?
The best advice I ever got was in the Air Force, where one of the general officers I worked with just said, look, the most important thing about your next job is your current job, right? Just knock the cover off the ball in your current job, and you will have opportunity. And I try to tell people, don't just focus on your current job. Make sure you've got options for yourself, but you'll only have those options if you perform. And I think that's been a great piece of advice for me, because my career has taken some weird moves, and nobody would have scripted it this way.
That's not
you wouldn't have said, oh, do this or do that. But I've ended up in a good place. So I've always think that's pretty good advice. And
that's great advice. Yeah.
Fortunate that I got it early in my career.
All right. So you're a board member with IPR. You've been there for I don't even know how long. As long as I've been.
Well, you haven't asked me to leave yet, and which means I haven't been there that long.
I would never ask you to leave.
So no, I've been there it's my second term on the board, and it's been great. It's been great to be with the colleagues in the industry, and then obviously believe in what you're doing and what the team is doing in terms of really trying to bring research to bear for what we do every day. And it's a critical piece of what we need to do as a discipline.
Thank you. Mm-hmm. That's great. So now we're going to go to the locker room.
We're going into the locker room.
So here we are in the Vikings locker room.
Yes.
This is a first for me, just so you know.
It's a first for many people to be in the locker room.
Have you been here before?
I received a tour here before, and but not a lot of people get into the locker room.
So these are questions I took from inside the actor's studio. Obviously not very original, but I just borrowed them, I'll say.
This is sort of inside
it's inside
actor's locker room.
That's right.
It's kind of your shtick.
That's right, exactly.
And we're in a car.
For
IPR.
It's just a large locker room. It's mobile
Exactly.
There you go. Room. So I'm going to ask you a bunch of questions that James Lipton used to ask those actors and actresses.
Excellent.
For our interview. So
Excellent.
You ready?
I'm ready.
Okay. What's your favorite word?
Serendipity.
Nice.
Very serendipitous that I came up with that.
I know, that was good. I like how you did that.
Yeah, it's a great word.
Just like it?
No, I like it. I like the way it sounds, and then I like what it means, and I believe in serendipity, that sometimes the things just come together, so.
Like in a car with IPR in a Minnesota Vikings locker room.
Next thing you know, we're in the locker room.
I know. How did that happen? Okay, favorite song, favorite band?
Rolling Stones, my favorite group, for sure. And
they're on tour. Did you see them?
They're on tour. No, they did not come here, which is a miss.
Yeah.
But I have seen them a couple times over my life, and there's a guy who just benefited from medical technology. Mick Jagger just got a heart valve. Been well documented. But there's an individual whose life is going to go on for as long as those guys can go on, which seems like forever.
Okay, so what do you do to unwind, relax, recharge?
I'm a golfer. I love to golf. My wife golfs. We'll keep going. My wife is a golfer. My 2 boys golf, and so we like to do it as a family. We'll play 9 holes and get some dinner kind of thing. And I don't play enough to get better.
If God does exist, or heaven exists, or whatever, what would you want God to say when you enter the pearly gates?
That you did something for someone else, right? And that's the moments, right, we care about. So it's obviously you want to, we're focused on raising our kids and making them productive. And so, what's the line? Have you been a faithful servant, and of your people and of your family and of your community? And I think we all strive to do that, and that's what's written on the stone, right? Is that not how many days did you work, or were you on call, and did you answer that email? And nobody cares about that in the end. So it's those things we all appreciate in life.
It's a good way to end.
Yeah, thanks for coming.
So, Rob, thanks for being here today. This was really great. Yeah. And great talking to you and taking us on a tour of your city and the stadium.
Well, it's a great stadium, and we're just really honored to be a part of it in some way, because it is a big part of our community. Want to thank the Vikings, too, for hosting us in U.S. Bank Stadium, and the folks that allowed us to be here, but principally the Vikings that have been our partner. And it was a lot of good fun. And when they're in the Super Bowl, which they will be this year, maybe I'll invite you. And the board will invite the IPR folks to come to the Super Bowl to see the Vikings win.
That would be amazing.
Their first Super Bowl.
That would be
year.
Amazing.
All right.
Well, thank you so much for joining us today for this episode of In a Car with IPR. If you like what you see, please like our channel and follow us on YouTube, and we'll see you for the next one.
Thank you for watching this episode of In a Car with IPR. Want to make a tax-deductible contribution to support this series and fund research in the profession? Please visit us at instituteforpr.org/contribute.